Hi, and welcome to my research methods in public health presentation by mravlek-bonello. My topic is, does the use of fitness apps for Australian adolescents during secondary school promote physical activity? The reason why I've chosen to use this topic is because according to Australian Physical Activity and Sedentary Guidelines, which are created by the Australian Government, Australian children and youth aged between 15 and 17 should be completing at least 60 minutes of physical activity every day and bone and strengthening training at least 3 times per week. But only currently 20% are meeting this standard. 70% of children, however, and youth, however, are participating in organised sport. 1 in 4 are either walking or riding their bikes to school, but these numbers have dropped dramatically since 2003, when 44% were riding or walking to school. This graph demonstrates that the levels of enjoyment of physical activity has decreased. And you can see on the graph on the left-hand side how children aged between 10 and 11 used to love participating in sport. But there was a slight increase to kids who kind of liked it a little bit, but not as much as others. Then on the right-hand side, you can see that the graph that is absolutely soaring on the right-hand side shows that children aged 12 to 13 just not enjoying physical activity as much, or even not at all. Only 63 males and 54 females enjoy physical activity quite a lot, which is quite alarming and quite interesting. My other background is when physical activity guidelines were implemented, so were sedentary guidelines. And these sedentary guidelines were to help people get a bit more active or show them how long they should spend on electronic media devices. So the first one is that sedentary behaviour should be kept to a minimum by breaking up long periods of sitting with walking or exercise. Less than 2 hours of electronic media and entertainment devices should be used, with a recent study from Vic Health saying that prolonged sitting was associated with premature mortality, type 2 diabetes, and a risk factor for all non-communicable diseases. This is my second graph, and it shows that from June 2018 in Australians, the time spent on social media or media devices, with the average daily time spent using the internet or any device over on the far left-hand side being 5 hours and 34 minutes a day. That's huge. That's huge, especially when all we are asking for Australian children and youth is 60 minutes per day of exercise, but they can spend 5 hours or more a day doing that. Currently, we're spending 1 hour and nearly 40 minutes a day using social media. We're spending 3 hours per day doing broadcasting, streaming, watching TV, and 42 minutes per day listening to streaming music. We could use that 42 minutes of streaming music on the right-hand side, where we could encourage children and youth to be streaming that music while exercising, while being physically active, and doing something creative and positive. So what is making our youth and children so inactive in Australia? It is our mobile phones and our electronic media. Just over 1 million Australian youth aged between 14 and 17 years of age have a mobile phone. 78% of these phones are owned by someone else. They're generally owned by their parents and guardians, and they're also the people that pay for the bill. 30% say they would go over their data or prepaid money per month, which is really hard to see that that's what they're doing with their social media. 50% say they just couldn't live without their mobile phones. If someone took it away from them for a day, they didn't feel like they could function, go to school, do anything. They'd honestly just mope around, not knowing how to exist in life. So the question is, but can these mobile phones be used in a more positive way? And can this way be used to promote physical activity in secondary school settings? My research objective is, for the aim of the study, is to explore how using a fitness-based mobile phone app, such as the Nike Training Club, which I'll be using, can contribute to promoting physical activities in Australian youth in a secondary school setting. And that's just a picture showing how students can jump on. It shows lots of images. You choose a goal and you can choose a level, and it gives you an example of the level. My methodology is, the study will be an 8-week training study in correspondence with a 10-week term, which is the average 10-week term. Week 1 and 10 of the term will be pre and post surveys, and the 8 weeks will be of 8 weeks of physical activity training. I will have 30 female participants aged between 30 to 60 years of age, 13 to 16 years of age, that will participate. They will volunteer for the study. It's completely up to them, but then they will be split into 2 randomized groups. Group 1 will use the Nike training app and record the results, as you can do within the app, which is a really great feature. Group 2 will use the Nike training app, but they will also come to 2 30-minute lunchtime training sessions using the app with me at lunchtimes. All training must be recorded. So if they use it any more than that, they still need to record it. The pre-survey will be sent to both groups, asking them to evaluate currently how often they train, how many times a week, and if they use a mobile phone app to help them apart from the app that they are using previously. Post-survey is another survey, and that will be sent out using Google Forms, asking them the same set of questions. My research hypothesis is that my independent variable will be the Nike Training Club app and usage of it. My dependent variable will be the promotion of physical activity and the increase in physical activity levels. The study population is 30 female students at a Catholic all-girls school in the western suburbs of Melbourne. They will be aged 13 to 16. They have a mix of nationalities. They'll be randomly selected into group 1 or 2 by a computer-generated system that you just put the students in. The girls get numbered 1 to 30 and then randomly selects 2, 5, 7, 8, 9 in this one or this one. It will be a lunchtime-based activity, 30 minutes in duration. This will be completed in the school sports hall every Tuesday and Thursday from 1 p.m. to 1:30. 30 minutes of the Nike Club app program workout. Tuesdays will be cardiovascular-based workout and Thursdays will be muscular endurance and strength. Fitness testing is not part of this experiment. I'm not going out there to reach a particular health goal or fitness goal. It is about just promoting physical activity. So my selection criteria includes inclusions and exclusions. So they must be 13 to 16 years of age, female, and studying at the school. They must be available for both days and for that duration of time. They need to have a mobile phone app, be able to use a mobile phone. They need to be able to have the internet and be able to download this app and use it. Have not previously used this app or anyone similar. They must record all their results in this app and submit it at the end of the experiment with surveys. They need to have no medical conditions that would prohibit them from exercise or physical activity, and they need to have permission from their parents or guardians. My ethical considerations is that the school has given permission for this experiment to be taken part, but the students must get their parent or guardian permission. I do have my own ethical consideration when making sure that they are physically and mentally capable of this, and duty of care as a teacher and a staff member is essential. My data collection will be done by surveys, pre and post, using a Google form that will be sent out to the girls. In the Google form, they do have to put their name and answer long answer questions, so they will be providing as much detail as possible. My other form is via the Nike Fitness app, the Nike Training app, and this allows participants to input and store and record data when they use the app. It shows how long they used the workout for because it does a step-by-step video, what time, what date, how often did they use that specific workout. If the girls also have the Apple Watch, you are able to download the app on that, and it does provide them with extra breakdown of details such as their heart rate, the heart rate intensity, steps, and calories burnt, but that is up to girls. I'm not asking them to buy an app, that's just up to them. The app also provides them a weekly breakdown of how often they used it, how many workouts they did, what workouts they did, provides them an average duration and common themes such as if outside of the 2 workouts that group 2 will be participating, if they did any others, it will come up with that. It also comes up with a monthly breakdown, and you can input an 8-week training program breakdown. Then these data and results are stored, and the girls can email them and will be emailing them to me at the end of the program, also weekly, so I can see results. Here is a list of my references. All my references are based on Australia, on movement guidelines, active walking, but they are there as well. Thank you for your time, and I hope you enjoyed my research proposal.